If your brain replays conversations from maybe earlier today, yesterday, a month ago, if your brain pushes you to try to predict problems or analyze situations way after they've already happened, a situation happened like a month ago, you're not broken. This is overthinking. You're experiencing overthinking, and you're experiencing overthinking loop, right? That there's a loop in overthinking that we can get stuck in, and we're just like on this car, and you're like, get me out of here. I don't want to be in here. And there's a reason for it. My name is Dr. Santos. I'm a licensed counselor, been in the field for over a decade, bring a lot of that clinical experience and opportunity into these videos, into courses that I've developed or books that I've written, into all of that so that you can have applicable support. I'm a big believer in take that complex thing and make it simple into a skill so I can learn it, apply it, and then keep trucking forward. So, what is overthinking? Like, what exactly is it? I like to start with overthinking it's not thinking too much, which sometimes people will say that, like, I'm overthinking. Am I just thinking too much? No, no, no. It's it's a mental safety behavior. All those three words together, mental safety behavior, right? So it's a behavior that we do for mental safety. Couple it together. The brain, right? The brain's got a job. The brain wanders, the brain thinks. Now, if your brain popped out, the brain may say, "Hey, I'm analyzing. I'm replaying these situations and predicting." So when it engages in that, right, the brain believes that analyzing, replaying, and predicting will stop or reduce or eliminate emotional pain, prevent me from making mistakes. And then if you can see that, that turns into this loop now that becomes overthinking. So it keeps scanning the field, it keeps scanning the field for certainty. And that's what causes us to get into that space of overthinking. And of course, environments and development, places we've lived, situations we've been in, can have a large impact. Now, why it feels uncontrollable? That's a very common question I'll get. As Dr. Santos, it feels like I can't control this. I can't control myself from overthinking. Well, there's two systems that drive overthinking, right? You got system one, and then I'll pretend I'll grab something else. You got system two. Number one, cognitive control, right? This system here is trying to solve or prevent. Now, this system here, nervous system activation system, we'll call that one. It's subtle threat state. When both of these systems are active, when they come together, now I know it's a notebook, which is really cool. It's something my wife got me years ago. It's a leather bound, and then I keep a journal here with all my um, therapy things that I find really cool. And then I've got a random Santos counseling pen. Nothing to do with the video, but I thought I'd share it with you anyway. So you got these two systems, and they're both active, right? What if I should have? What does this mean? This causes an effect, right? These come together. The loop now, it feels urgent, even even when nothing's happened, right? Which is the wild thing about this space of overthinking. Often nothing has happened, yet you bring these two together: cognitive control, one, the other, the nervous system activation. And as I mentioned before, the cognitive control that's trying to solve or prevent something, and then the nervous system activation, it shifts you into this subtle straight mode, and you bring those together. Now you're in this loop, and the brain's thinking, what if? I should have done this. What does it mean? Blank, blank, blank. And it feels so urgent, doesn't it? It feels so urgent. And you think back and you're like, I know it wasn't even urgent, but somehow I was just in that space. Now, why logic alone doesn't stop me from overthinking? Many individuals will say, listen, Juan, I'm a lawyer, I'm really sharp, or I'm smart, and all of those things, right? And it's a great question. Like, why can't I just use logic to get out of here, to go stop overthinking? Some people will do things like, all right, this isn't important, or I've already dealt with this, I already handled this. So kind of think your way through it. Well, remember those two things I told you about. One of them was the nervous system. The nervous system light switch is on, it's activated. And when it's activated, you are in the loop, right? So you're in the passenger seat of a car, you're in the loop and you're going. It's kind of hard from the passenger seat to stop the car. That's why overthinking is partly a cognitive and a physiological um, space, right? It impacts both of those areas. So, question you may be thinking is, how do I stop it? How do I interrupt this loop? How do I go from the passenger seat to the driver's seat? Well, a couple of things we could do. Labeling the loop, shifting attention to sensation, grounding attention externally, limiting analysis time. Let me give you an example of one of those. Shifting attention to sensation, right? I am in this space, I'm in this room. I think about, what do I sense? What do I smell? I've got a candle going on over there. It's got a nice eucalyptus smell, so that's one of my senses, right? That right there, that's a grounding technique. It helps to get that light switch of the nervous system being activated. It brings it down just a little bit to bring me back into control, to then shift me from that passenger seat to the driver's seat. It may not be fully effective or the full thing that does it. I may have to do more of those techniques mentioned there. But as you've noticed, right, that is a skill that we can learn and we can practice and then we can implement into life. Now, this I'm sharing with you, and there's so much more to this. Years ago, I created a course, Managing Anxiety. And I get feedback from students all the time sharing just really amazing stories of where they were with their anxiety to where they're now and managing it and going from that passenger seat to that driver's seat. And I'm sharing it with you in this video because you're watching it and you're experiencing overthinking. Overthinking has to do with anxiety. In the course, I've taken over a decade of work in the field, academics all the way from master's to doctorate degree, work with cases with patients. I brought all of that into the course. I've removed the complexity. And then I shifted it into this structured sequence, right? It takes you from A all the way to Z. And in there you have skills. Skills are learnable. I love skills. Skills are learnable. And a lot of this, the bulk of this when it comes to anxiety that you and I are getting into, spending time on, it has to do with learning skills, right? Just like that sensation one that I showed you. What do I smell? I smell that eucalyptus. That's a skill, being able to practice stopping, refocusing my attention, right? Shifting. Though that is how we support those core areas of anxiety. If you're watching this, I'm gonna take an educated guess. Anxiety is impacting your life, whether it's on a lower level or on a very high level. There's an impact of anxiety, and to a degree, anxiety impacts many of us. Right? There's internal anxiety, and then just the world that throws some anxious things that can take place, and that means that the nervous system gets activated, gets a little bit out of whack, and then we need those skills. Go to the description below in the video. Click on the managing course. I'll tell you one thing. I made it affordable and I did it on purpose. Jump in there, take the course. As you're going in there, reach out if you ever have questions. One thing that I do, and I'll tell you this, and you're probably going to get excited about it, I update it ongoing. I put new material in. As I'm learning in the field, working with patients, I pull the complexity out. I plug in skills so that you have a space of support, healing, growth, and yes, skills that are learnable. Hope you found this video helpful. Share with a friend, subscribe, all that good stuff. I'll see you in the next one.